Hello everyone, my name is Dr. Rahul Mohandas and today we'll be seeing about the principal fibers of the periodontium. Okay. So what is periodontium? Periodontium basically is the attachment apparatus of the tooth, okay, and it actually includes four important structures. Okay, it includes two soft tissues and two hard tissues. The soft tissues are the gingiva and the periodontal ligament, whereas the hard tissues are the cementum and alveolar bone. All these four structures together form the periodontium. Among these two, the soft tissues, the gingiva and periodontal ligament, the core of these two soft tissues is the fibers that are present in these two tissues. Those fibers are called as principal fibers, and these principal fibers are basically made of type 1 and type 3 collagen. Okay. So there are two types of fibers. There are gingival fibers and there are periodontal fibers. Periodontal fibers are also called as dento-alveolar fibers because dento-alveolar fibers or periodontal fibers, it connects the tooth to the bone directly, whereas the gingival fibers is the attachment between the tooth and the gingiva. Okay. So there are gingival fibers which are present on the top or the coronal portion, and these are gingival fibers or gingival group of fibers, and these are periodontal fibers between the cementum and the alveolar bone, which are present in the radicular portion. Okay. So first we'll talk about gingival fibers. Gingival fibers, there are four basic or major group of gingival fibers. Okay, first one is dento-periosteal group of fibers. The dento-periosteal, as the name suggests, it's between the dento or the tooth part of the tooth and the periosteal, that is the bone. Okay, so you have the fibers which are blue in color. They run from the tooth or the cementum and it goes to the periosteum or to the bone. Okay, the blue colored fibers. Then we have the dentogingival group of fibers which starts from the cementum and it goes into the connective tissue of the gingiva. These red colored fibers are your dentogingival fibers. Then you have the alveologingival fibers, that are these green colored fibers which starts from the bone or alveolar bone and it goes into the connective tissue of the gingiva. Okay, and then you have the fourth group of fibers which are circular fibers, which are denoted in yellow. And since this is a longitudinal section, we can't see the entire fibers, but it is going in a circular manner and we are seeing only the cut section of those fibers. So these are the four important group of gingival fibers. Apart from these, there are some accessory gingival fibers also, like you have the transeptal fibers which start from one cementum of one tooth and it goes to the cementum of the opposite or the neighboring tooth. Then you have semicircular fibers which run in a semicircular direction, which starts from the mesial aspect on one side and goes to the distal aspect of one tooth. That is the semicircular fibers. You have interpapillary fibers, you have transgingival fibers. So all these are accessory fibers, which accessory gingival fibers, which are in addition to the four principal fibers of gingiva. Okay. So these are the next group of fibers are your periodontal fibers. So periodontal fibers or dento-alveolar fibers, it runs from the cementum and goes into the alveolar bone. Okay, so there are five basic or major group of periodontal fibers. The first group, it starts from the cementum and it goes into the bone, the crest of the bone. So it is in a coronal direction. Okay, as you can see, it is in a coronal direction. The fibers are running in a coronal direction. It starts from the cementum and goes into the alveolar crest. It is called as alveolar crest group of fibers. Okay, so alveolar crest group of fibers, they resist the tipping forces. Okay, the tipping forces. Then we have the horizontal group of fibers. Horizontal group of fibers, they will resist the horizontal or the lateral movement of the tooth, and they are present in a horizontal or perpendicular direction, and again they run from the cementum to the alveolar bone in a perpendicular direction. Then we have oblique group of fibers. Again, oblique group are the most abundant group of fibers, oblique group of fibers, and here you can see that they are running in an apical direction. So here the difference is in that the alveolar crest group of fibers are in a coronal direction, whereas in case of your oblique fibers, they're in an apical direction, and again they resist the tipping forces of the tooth. The tipping forces are resisted by the oblique group of fibers, and the most abundant fibers are also the oblique group of fibers. Then you have apical group of fibers. These apical group of fibers are present in the root apex and they are attaching the tooth to the fundus of the alveolar bone, to the fundus of the alveolar bone. And one important point to notice is that the apical group of fibers will not be seen in incompletely root formed roots. So only when the root completion is complete, the root formation is complete, only then you will see apical group of fibers. and apical group of fibers prevent the extrusion of the teeth. Finally, we have the interradicular group of fibers. They are present in multi-rooted teeth, and they run from the between the two, they run from the furcation into the again to the fundus of the root or to the alveolar bone. Okay, and important thing to remember here also is that wherever there is furcation involvement, in those cases the interradicular group of fibers are absent. Interradicular group of fibers are absent whenever there is furcation involvement. Okay, so that's all about the principal fibers of periodontium.